At this juncture, I would like to invite the cancer survivors who are here. Thank you. Please come forward and give us share with us your story.
Namsalimu katika jina la Yesu Kristo. Amjambo. Sitaenda mambo mengi, tuko watatu na mmoja aeleze. Sasa nataka nichukue tu nafasi kidogo ili kila mtu ajue kwanza ni ugonjwa inaweza tibiwa. Kwa majina naitwa Margaret Uside, nimeokoka na mpendo. 11 nilikuja kwa hiyo na rafiki yangu wana makanza hali yako, na nikajisikia moyo wangu ukisema wacha niende nijangu. Nilipokuja nilichukuliwa, nikapimwa, nikapatikana, wakatoa nyama kidogo ndani ya tumbo, waliporudi niliporudi nikachekiwa, nikapatikana niko nayo, na akanibuku, nikakuja nikachombolewa ndani ya tumbo, wakanichoma ndani kliniki. Ya kwanza ilikuwa 6, ya pili ilikuwa mwaka 1, ya tatu ilikuwa mwezi 8, na nikapona kanza. Kwa sasa hivi mimi ni mzima kabisa kabisa, na sichoki. Wakati nilikuja kujua hali yangu, naomba mwanamkenya popote ulipo, tafadhali enda ujue afya yako. Kujua afya yako, wanasema kuzuia ni bora kuliko kutibu. Au madaktari wanataka kutibu, lakini Mwenyezi Mungu anapitia ndani, uponyaji inapatikana. Jina la Bwana litukuzwe. Niko hapa kuhimiza Mkenya, chukua hatua ya haraka. Tunachukua hatua kama tumechelewa, hapo ndipo tunapata shida na tunakufa kwa sababu ya kanza. Kanza ni ugonjwa inaweza tibiwa. Kanza ina matibabu. Mungu awabariki. Nipeane kidude kwa mwingine ili akaendelee.
Bwana Yesu asifiwe wapendwa. Asifiwe tena. Wageni wetu wa siku ya leo, Your Excellency Madam Margaret na wageni wengine, na wasalimu katika jina la Yesu. Amjambo. Amjambo tena. Hakika ninaitwa isiyokuwa na kifani. Kwa majina yangu ninaitwa Gladys Nekoye Marani, natoka Lukusi Center, Webuye East. Siku ya kwanza nilipokunduliwa niko na kanza 2018 mwezi wa 8 tarehe 2, hakika I was shocked. Nikalia, nikatetemeka, lakini nashukuru Mungu. Dr. Doris alisimama pamoja na daktari wengine nurses, wakaniombea, wakanitia moyo, wakanishauri. Wakati nilipatikana niko na kanza, nilipata ujumbe kupitia kwa radio zetu 2, Sulwe pamoja na Mbo. Na signs and symptoms they were talking about nilikuwa nazo. Hiyo ni foul smell, harufu mbaya mbaya, maji yenye inatoka mwezi wa 10. Then nikaanzishwa clinic Kenyatta. I went through chemoradiation and brachytherapy zote nikamaliza, na nikaanza kliniki yangu Kenyatta, ambayo nilikwama kuenda 2020 mwezi wa 3 due to corona, na after there peso naye ikawa ngumu. Sasa sijaenda, sikuwa nikiendelea na kliniki huko, pati huwa nakuja hapa. Nashukuru nurses wa hapa na doctors wa hapa wananitia moyo, wananiambia bado I'm stable, I'm okay, sina chochote. Nashukuru Mungu. So wapendwa, naendelea kuwahimiza ya kwamba popote mnapoenda, mimi huku kwangu Lukusi nimekuwa muinjilisti, nimekuwa nikikampaign to cancer, na nashukuru Mungu kuna wapendwa wenye wamekuwa wakikuja hapa for screening. Mkile nyumbani msiwe mnanyamaza. Unapata kanza, unapatikana kanza at its early stage, inatipiwa na unapona. Lakini ukingoja, kuna wengine wananiambia mimi sitaki kupimwa sababu nikipatikana niko na kansa nitashtuka. Na sasa ukishtuka na ukufe na upatikane naye ati the late stage 4, hiyo ndio itakuwa shida. Kwa hivyo naumiza wapendwa, wewe penye mnaenda fanya ule uinjilisti popote penye mnakanyaka, hata makanisani, na tuweze kupata watu wengi wafanyiwe screening kusudi wasiche wakafa. Ni hayo tu, mbarikiwe.
Bwana asifiwe. The First Lady Bungoma County, First Ladies from other counties, karibuni Bungoma. Wenye tumekuja kuhudhuria hii commemoration ya celebrate kanza na kuhimizana juu ya kanza, wote karibuni. Bwana asifiwe. Mimi naitwa Sara Kisebe, mimi ni muuguzi, nafanya kazi Webuye County Hospital. Mimi ni breast cancer survivor. Niko na titi moja, titi lingine ni bandia. Nilikuwa nafanya self breast exam kwa nyumba, nikiguza titi langu la right, nikapata kuna uvimbe ndani mdogo. So nikiguza hiyo uvimbe, haikukuweko kitambo, lakini siku hiyo uvimbe ilikuwa. Nikashangaa kwa nini, so ikabidi niende hospitali. Nikaenda MTRH, wakachukua nyama kidogo, wakaenda wakapima. Results after 2 weeks ikasema niko na ductal cell carcinoma, niko na kanza ya breast. So venye nilipatikana niko na kanza ya breast, nikasikia vibaya kwa ajili mimi ni muuguzi, nikashangaa ni aje, status ni aje. So leo nataka niwaambie kanza haichagui status, kanza haichagui wewe ni nani, inapata kila mtu. Sasa leo himizo langu la kwanza ni tafadhali kina mama, kama uko na matiti yako mbili na unatembea nayo every day, guza matiti yako in front of a mirror. Hebu angalia matiti yako imekaa aje. Kama kuna anything funny, kitu inavuta ndani, skin imechange ama uvimbe yoyote, therapy, nikakatwa matiti, inaitwa mastectomy. Wanakata kabisa, wanamaliza. During that staging, waliniambia ilikuwa stage 2. Imagine inaanza. Mimi ni healthcare provider. Don't take nafundisha wamama kupima, lakini kidogo nilisahau kupima titi langu. So by the time nilikuwa naipata, kanza ilikuwa already iko stage 2. But nashukuru Mungu, nilienda hospitali wa stage 2. Nyama ilitolewa ipelekwe, nikafanywa radiotherapy. Mimi ni mzima leo. Hapa Webuye on borrowed time. Imagine tu, mimi ni healthcare provider. So my biggest message is to my colleagues. Kidogo nilisahau kupima. The ladies who feel like, so by the time kidogo, nashukuru Mungu in taking medical care. Nikafanywa radiotherapy, tunashida leo. Hata hiyo screening room, Doris can attest to that. A small number ya healthcare providers seek the service. Na the ladies wenye wanadhani sisi tuko juu kidogo, kanza iwezi kuwapata. The news today ni kanza iko inaweza shika mtu yeyote mwenye anapumua. So kama uko hapa leo na haujaguza matiti yako jana, please leo ukienda, let it be the first thing you'll do. Guza matiti yako mbili na unaguza mpaka kwa makwapa. Uvimbe yoyote, chochote kinakuvuta ndani, inaweza kuwa ni kanza. Njoo tukukonfirmie, kama ni kanza, uanze matibabu mapema na utapona. Cancer is treatable, it is not a death sentence. Na shida kubwa huku nyumbani ukipatikana uko na kanza, hata mimi kuna wenye walikuja wakaniambia nimerogwa. Kuna mwenye aliniletea mitishamba, lakini nikamwambia sasa na mimi ni nurse, na kunywaje mitishamba? Nikamwambia hapana, stop tempting me. So you'll be tempted. Marafiki watakwambia vitu mingi, ati GNLD na tibu, chemo itakuua, don't accept that. Kuna protocol ya treatment. Ukipatikana na kanza, enda kunywa chemo. Itakuumiza, utasikia vibaya, lakini by the end of the day itakusaidia. Itaua cancer cells na utakuwa mzima. So ninahimiza wauguzi, kama unaona screening hapa Webuye ni ngumu, basi enda Kakamega ukue screened, so that you know your status. Kwa sababu cancer is real and it is here with us. So nawashukuru sana kwa kukuja. The First Lady for supporting us. Thank you so much. Thank you Dr. Kisaka for hosting us. Asanteni sana. Kumbukeni screening is a must. Check your BP weekly. Asante.
Wow, unajua unaweza kuwa overjovial mpaka ukasahau vitu zingine. Madam, Your Excellency. Hebu nione. Niko smart, si ndio? Ni madam wa kusikia na kutenda. I remember last month vile tulikuwa hapa, niliomba uniform. Aki madam umetufanyia. Mpaka Sister Dora akasema ni kama ulijua utapewa t-shirt yenye naenda na nguo yako. Madam, be blessed and be blessed abundantly.
Thank you so much. Tupige makofi. Asante sana cancer survivors. At this juncture, I want to invite the Deputy Director, Medical Services, Daktari Karibu.
Thank you, Daktari. Your Excellency, Deputy Governor, Your Excellencies, the First Ladies from Migori, Nyamira, Kericho, Kakamega, karibuni sana Bungoma. Our CEC, we have our CEC from gender, all protocols observed. Good morning. Good morning again. Yeah, so kwa majina naitwa Dr. Emma Nyaboke. I'm the Deputy County Director of Health and Sanitation. And today we are commemorating the Cancer Awareness Day, cervical cancer. For the whole of this month, we have been participating in increasing the number of screening in Bungoma County as a whole. And we had our focus in Webuye, increasing the number of HPV vaccines. And I want to appreciate that Bungoma County, we have done really well. We have improved from last year, though we are not yet there. But we will still continue working hard to make sure that, as Dr. Kisaka said, next year we should not sit here again and say that we are still struggling with cervical cancer. Sindio? Yeah, I know the whole process as ladies is not the easiest, but from the survivors you can get that the treatment process is even the most difficult part. Sindio? Yeah, so as ladies, we rather get the preventive part. Make sure we are screening, make sure we are taking our kids, the ones who have not been exposed, to get the HPV vaccines. The vaccines are there in plenty. The screening materials are there in plenty. Let us be the champions. Let us work and make sure that we are being screened. Let us make sure our neighbors are being screened so that we bring down the level of cervical cancer. Let us also continue screening ourselves, as one of the survivors has said. Most of the time, the healthcare workers, we are concentrated in giving service to other people and we forget ourselves. Yeah, so once in a while, you also remember and look at yourself and see how you're doing for us to be healthy and be able to give health services to the other people. Yeah, so because of time, I have a long list of people here I want to introduce, but I'll have them standing and waving, and then we'll have a few of them giving us remarks. So, Your Excellency, we invited the sub-county teams. Kindly just stand and wave. Yeah, so most of them are our RH coordinators, the sub-county nurses. We also have the MOHs. MOHs in the house, kindly stand and wave. Thank you, Daktari, thank you. We also have the CHMT, heads of division around. Kindly stand. Thank you very much, thank you very much. Yeah, so Your Excellency, this is the team that takes care of us to make sure that we are coordinating services in the county to make sure that we are taking care of your people. Yeah, so at this juncture, I'd like to invite one of the CHMT members who's in charge of maternal, neonatal, and child healthcare to give us the status of cervical cancer in the county, Mrs. Milsen Kiplai. Karibu.
Thank you. Your Excellency, our First Lady, Mama Margaret Makelo, the visiting First Ladies from our sister counties, Your Excellency, Deputy Governor Bungoma County, Pastor Jennifer Mbatian, CC's health and gender, all protocols observed. My name is Vincent Kiplai. I head the Division of Reproductive, Maternal, Child and Adolescent Health in the county. This is where issues cancer of the reproductive system fall. I want to say that we are glad as a county that we are hosting the Lake Region Economic Bloc climax. We sincerely welcome our first ladies from the Lake Region Economic Bloc. And I also want to appreciate the teams in the county who are working very hard to ensure that the people of Bungoma get quality services. On issues cancer of the cervix, like the previous speaker said, cancer is not a death sentence. We have so many people who have gone through the process of recovery after being diagnosed with the cancer, and they are living quality life. What we need to do as a community is, let's pick the practice of ensuring that we are screened. Screening identifies early cancer, and cancer of the cervix is one of the cancers that is highly treatable if diagnosed early. So each one of us, I'm requesting that this day, let it be the symbolic day one of our journey towards stopping cancer within our community. It is our responsibility, and being part of the community, let's hold each other's hands. That when you get an opportunity, talk cancer. Every time we have a platform in the church, in the school, everywhere, day one of a journey towards our people about stopping cancer within our community. It is our responsibility, and being part of the community, let's hold each other's hands. That when you get an opportunity, talk cancer. Having every so many cases of cancer of the cervix which are diagnosed at a very late stage. Looking at our cultural background, some of us are, what I can say, very conservative, that we wouldn't want to expose ourselves. Thinking that when I go out there, the healthcare provider will examine me and many other things. Somebody is thinking I'm a woman and maybe the examiner will be a male. Because of our cultural background, I would want to keep off. Let's get those ideas out of our minds. The healthcare providers are there for us. Pick those services. We have trained our healthcare providers to the lowest level, up to the dispensary. If you walk into the nearest facility in your village, you'll find a healthcare provider who has been capacity built and is able to do screening for cancer of the cervix. We do the screening, and we are able to do treatment within our county. That Bungoma County Referral Hospital and the Webuye County Hospital are able to do treatment for lesions which cannot be handled at the lower level. For lesions which are not able to be handled within our two main facilities, then we'll refer you to MTRH. But the trick is do screening so that if cancer is identified early, we can be able to handle it at the dispensary level. Bungoma County has a large population. You remember it is one of the most populous counties in the country. So this again informs the numbers in terms of cancer of the cervix cases. In this county, we have trained 192 healthcare providers to screen and treat cancer in all our facilities. And the trainings are going on. We have mentors who continue to support the healthcare providers who have not been trained. And we are hoping that very soon we shall have 100% coverage, where if a client walks into our facilities, any of the healthcare providers can be able to offer screening services. So we have trained 192. Mentorship is ongoing. This was done with support from the National the National Cancer Program at the national level. We appreciate that. Then we have a number of equipment within our facilities. We have 21 cryotherapy machines. We have 6 lip machines, and we have 32 thermal ablation machines. These are machines which can be used to treat cancers of the cervix at an early stage. This we also want to appreciate our partner, CHAI, that is Clinton Health Access Initiative, for supporting us with the equipment. We appreciate that. We also have support from one of our partners, Dumisha. I can see Susan there. Dumisha, we appreciate you. They have also supported us in terms of equipment and training for the healthcare providers. In terms of screening for cancer of the cervix, in the year 2020, we were able to screen 7,247 clients, and out of this number, 268 of them turned positive. 268 turned positive, and they were in different stages. Many of them were handled at our lower level facilities. In the year 2021, we screened 12,960 clients in our facilities, and 611 of them turned positive. So it is a reality. We are not just saying cancer. It is a reality, and it is happening. In the year 2022, we were able to screen 11,782 clients, and out of this number, 541 turned positive, and we were able to manage them. So you can see the numbers are going up. So what we are doing is we want to, again, lay emphasis on the issue of information so that clients can come. You realize that the more the clients come, the higher the number of positives. I want to talk about the human papillomavirus vaccine, the HPV vaccine. This is one of our key interventions in terms of prevention. The vaccine targets girls aged 10 to 14 years. We deem them naive, and they may not have gotten exposure to the human papillomavirus. The human papillomavirus is transmitted sexually. If a woman has intercourse with a man who is infected with the HPV vaccine, then it is passed over to her. So this virus, there are different types, quite a number of them, so many. So these viruses tend to accumulate in the body, and with the time, they cause the changes within the cervical membrane. So the intervention, when the young girls are given this vaccine, it prevents them from getting the HPV virus. And the vaccine is given in 2 doses, dose 1, and then the second dose is given after an interval of 6 months. So as a county, in the year 2021, we were able to give 61,463 doses of HPV-1. You remember I said we give 1 dose, and then after 6 months, we do a repeat. So the first dose we gave in the year 2021, a total of 61,468. This is 69% coverage. It is not satisfactory enough, but we are working there. With the time, we shall be able to reach 90 or 95%. The same year, we gave 31,117 doses of HPV-2, the second dose. And that one converts to 31%. We still have a lot of work to do, and we have a strong team on the ground. We are working towards this, and we are hoping that next sitting, we shall have changed these statistics. In the year 2022, I want to say this, that in the year 2021, we did 69%, and we were number 4 nationally. Can we clap for Bungoma? Out of 47 counties. And then for HPV-2, we were number 2 nationally. And then 2022, we had a total of 28,564 first doses, which converts to 19.9%. And then HPV-2, we did 39,429, which is 27.5%. I want to appreciate the team on the ground that you've tried your best, and we still have more, a lot of space for improvement. I want to appreciate the Ministry of Education. Director Jemima was somewhere. We've worked closely with them. Without their support, we wouldn't have achieved this. You remember when the vaccine was initiated, there was a lot of resistance from some of our communities, and some of the parents were holding back their children. But after working closely with the Ministry of Education and explaining to them that we mean well with this vaccine, we were able to improve in terms of numbers.